So the first leadership skill that dentists really want to master to get their team to do more co-diagnosis is permission. Because here's the deal. We are told we are not supposed to diagnose, right? And while we all agree that the dentist makes the final diagnosis, sometimes we use this as an excuse to not to do more, not to share more with the patients. We are perfectly capable, and it is perfectly appropriate for your clinical team in general, right, to observe what's happening with the patient and to share those observations with the patient. To observe and document what's happening and to share that with the patient, okay? And I believe it's even appropriate for us to say, in the past, when I've seen this, doctor has recommended X, or doctor has recommended this or this, and he'll come in and he'll give the final, recommendation, okay? So the first step is giving your team permission to do that, permission to observe and permission to share those observations with the patient. Now, here's the next step, all right? So permission is the first one. We're going to come back to this in just a second. All right, so imagine this front door of this beautiful home is the door to the doctor's operatory. And your goal is to help the patient get from here, right? This is when they walk into your hygiene operatory. This is your time with them. And this is the doctor's operatory. So our goal is to get them from here all the way into saying yes, that they're ready for treatment. So we've got to figure out what are the different steps to get to there. And part of this permission is, doctors, you letting your team know how far down that diagnostic path you would like for them to take your patients. So some of you might say, I would like for my hygienist to take the patients right here, which is establishing the problem, and then I'm going to come down the steps and I'm going to come right here and I'm going to establish the solution. I'm going to share with them what the solution is. Totally fine. Some of you, we had a doctor in a class recently, and I asked that question is, how far do you want your hygienist to take patients down this diagnostic path? And he said, I want the patients to be ringing the doorbell. So before he comes in, he wants patients to be ringing the doorbell, which means really he comes in and all he has to do is just nod his head and say, yep, I completely agree with what you said, Rachel. Mary, that's what I would do. I would move forward with that right away, okay? So you've got to establish, doctors, where you want what you would like your clinical team to do in that regard, and then you've got to give them permission to do that. And it has to be explicit, because sometimes it's implied and you think maybe they know, but they don't really know. So you really have to explicitly say, I'm giving you permission, I believe in you, and I'm confident, and we're going to continue to work on your skills in this area, but I would like for you to really take this patient all the way down that diagnostic path as far as possible. And then I will come in and confirm the treatment, okay?